So do you have any question in the lacrimal system? Okay, so let's move now to the final part of our lecture, which is the blood supply of the eye, or the vascular supply of the eye. The arterial supply of the eye is coming from the branches from the common carotid artery. So the common carotid artery will give the external carotid and the internal carotid. The blood supply is coming from the internal carotid artery. So the internal carotid artery is the smallest branch of the common carotid artery. The level of bifurcation of the common carotid artery, it is at the upper border of thyroid cartilage, or at the level of the third cervical vertebrae, and it ends into the cranial cavity lateral to the optic chiasma by dividing into the anterior cerebral and the middle cerebral. The course of this artery is important, and it is important to identify what are its branches and what every branch supply. So here are the branches of the internal carotid artery. It starts first by the cervical part, which passes through the neck. Then a part which passes through the petrous bone, called the petrous part. Then the part which passes through the cavernous sinus, which is the cavernous part. Then to reach the intracranial cavity and divide into its terminal branches. So here is the first part, or the cervical part. This part ascends in line with the common carotid artery in the carotid sheath, or in the carotid canal, and this part which is present in the neck, and it has no branches. So the cervical part of the internal carotid artery doesn't have any branches. This will be followed by the petrous part. So the petrous part will be the part of the internal carotid artery lying inside the cavity of petrous bone. And this part will pass through within the petrous bone and give branches to supply the middle ear. So this branch will be called caroticotympanic arteries. So the caroticotympanic arteries are the only one branch of the petrous part of internal carotid artery. Then the internal carotid artery will enter the cavernous sinus. It pierces the cavernous sinus from the back, and then takes this S-shaped course within the cavernous sinus. Then it leaves the cavernous sinus from the roof. So remember that it will enter the cavernous sinus from the back and emerge from the cavernous sinus from the roof. As it enters, it will be the abducent nerve will be infralateral to the internal carotid artery, and as it emerges from the cavernous sinus, it will emerge between the second and the third cranial nerves. So what are the branches? The branches are the meningeal branches, or the meningeal arteries, supplying the meninges. And there are branches that will supply the pituitary gland, is called the hypophyseal arteries. So there will be superior hypophyseal artery and inferior hypophyseal artery. The final part is after emerging from the cavernous sinus. It is called the cerebral part. So the cerebral part arises from the roof of the cavernous sinus and curve backward to become lateral to optic chiasma, as we will see later on. So after it becomes lateral to the optic chiasma, it divides into its terminal branches. So its terminal branches are the anterior cerebral artery and the middle cerebral artery, and it gives only another three arteries: the ophthalmic artery, anterior choroidal artery, and posterior communicating artery. And here we finish the journey of the internal carotid artery. So let's revise it again. This is the common carotid artery in line with the internal jugular vein. It will divide into external carotid artery and internal carotid artery. There will be internal carotid artery within the internal jugular vein and vagus nerve into the carotid sheath. So it will start first by the cervical part passing into the neck. This part has no branches. Then it will enter into a cavity grooved into the in the body of the petrous bone. This groove is called the petrous canal, and the part this part is called the petrous part. This part will give only one branch, which is the carotid-tympanic membrane, carotid-tympanic artery, which will supply the middle ear. Then it will enter the cavernous sinus. It will enter the cavernous sinus from the back and has an S-shaped course into the cavernous sinus. Then it will emerge from the cavernous sinus from the roof. As it passes through the cavernous sinus, it will supply meningeal branches that will supply the meninges and give hypophyseal branches that will supply the pituitary gland. Then after it emerges from the cavernous sinus, it will then have the cervical part, which curves backward to be lateral to the optic chiasma, and then it gives its terminal branches, which are the anterior cerebral artery, the middle cerebral artery, and they give other three branches, which are the anterior choroidal artery, the posterior communicating artery, and finally the ophthalmic artery. The carotid system is the anterior vascular system. There is another posterior vascular system that runs in parallel to the anterior one, which is the vertebro-basilar system. So as you can see here, the carotid system. To the carotid system, there will be another system called the caroticobasilar system. So what is the caroticobasilar system? It starts by the fourth part of the vertebral artery. Here is the vertebral artery, pass in line with the vertebrae. The final part, it's called the fourth part of the vertebral artery. This artery enters the skull through the foramen magnum. Then it pierces the dura and the arachnoid of the posterior cranial fossa to enter the intracranial cavity, and then it ascends into the subarachnoid space and pass along the medulla oblongata. As you can see here, it passes along the medulla oblongata until the lower border of pons. It reaches the fourth part from the opposite side to make the basilar artery. So again, here is the fourth part of the vertebral artery. It passes after it passes the dural sheath. It ascends along the medulla oblongata, and at the lower border of the pons, it joins the fourth artery or the fourth vertebral artery from the other side to make the basilar. What are the branches of the fourth basilar? Then we have the anterior artery, posterior artery, posterior and posterior inferior. Then for the basilar artery, between both fourth part of the vertebral artery and lower border of pons, the groove. Basilar artery, the basilar artery dividing in posterior arteries. The cerebral arteries are the terminal branches of the So what are the branches of the basilar artery? The artery, the artery will end up formation of the cerebral artery. So branches basilar, we have arteries. We have the anterior inferior cerebellar artery to the cerebellum. We have superior cerebellar artery to the cerebellum. We have labyrinthine artery to the labyrinth. And finally, the terminal branches, which are the posterior cerebral arteries. Hello, is my voice clear? Since how long the voice is not clear? Last slides? Okay, no problem. I will repeat it. So I was just, is my voice clear now? Okay, so I was just discussing the basilar artery. So the basilar artery is formed by junction of the fourth part of vertebral artery on both sides and run on a groove in the pons and and at the upper end of bones, it will divide into external branches, which are the posterior cerebral arteries on both sides. So this is the basilar artery formed by junction of the vertebral arteries on both sides, and the branches of the basilar artery are pontine arteries, anterior inferior cerebellar artery, superior cerebellar artery, labyrinthine artery, and posterior cerebral arteries, which are the terminal branches. We have a circle of anastomosis at the brainstem. It's called the circle of Willis, which is its main function is to supply the hypothalamus and to bypass any obstruction in the shearing arteries. So, what are the arteries that share in the formation of the circle of Willis? This will be the anterior communicating artery. There will be a single anterior communicating artery, which is communicating between the two anterior cerebral arteries. Then we have two anterior cerebral arteries. Then we have two internal carotid arteries. Then it will pass through two posterior communicating arteries. And then it will be closed by the posterior cerebral arteries. So this is called the circle of Willis. Again, it is made by the anterior communicating artery, two anterior cerebral arteries, two internal carotid arteries, two posterior communicating arteries, and finally two posterior cerebral arteries. So sometimes in the exam you may be asked, what are the arteries sharing in the formation of the circle of Willis? Now we have the cerebral arteries. The cerebral arteries are, as we said, they are the terminal branches. So the middle and the anterior cerebral arteries are the terminal branches of the of the internal carotid artery, while the posterior cerebral artery is the terminal branch of the basilar artery. So which part of the brain does each one of these arteries supply? So if we have, this is the lateral section of the brain, and this is a medial section of the brain. So the anterior cerebral artery will supply areas in yellow. So in the medial brain, it will supply all the medial surface except the occipital lobe. And in the superior and in the lateral surface, it will supply a strip. This strip, it's about 1 inch in front of the parieto-occipital sulcus. So here is the parieto-occipital sulcus, and all this strip is supplied by the anterior cerebral artery. For the middle cerebral artery, it is supply the areas in red. So in the medial surface, it almost doesn't supply anything in the medial surface, but in the lateral surface, it supply all except the upper inch, which is supplied by the medial anterior cerebral artery, and the narrow strip behind the parieto-occipital sulcus and the temporal lobe. So the lower part or the lower border of the temporal lobe is not supplied. It is not supplied by it, and the occipital border is not supplied by it as well. Then finally, the posterior cerebral artery is for the medial surface. It is supplying the occipital lobe, as you can see here. And for the inferior surface, it supplies the tentorial part, the tentorial, which is the meningeal covering of the dural covering of the cerebellum. So it covers the tentorial part except the temporal lobe, and at the superior lateral surface, it will supply the narrow strip. So it will supply the occipital lobe and the narrow strip at the lower border of the temporal lobe. So here is the blood supply, or what every artery, which and the area corresponding to its blood supply. Here is again. So this is the medial surface. The medial surface is supplied by the anterior cerebral artery, except the occipital pool behind the parieto-occipital sulcus, and in the supply the upper inch of in front of parieto-occipital sulcus of the lateral surface. The middle cerebral artery will supply the lateral surface of the brain, except this upper edge, and the narrow strip or narrow of the temporal border, or the inferior border of the temporal lobe and the occipital lobe, and the posterior cerebral artery will supply the occipital lobe and this temporal strip and the occipital lobe till the parieto-occipital sulcus. This is for lateral, and for medial it will supply all the occipital lobe. Now we come to the most important topic in the vascular supply, which is simply it is the blood supply of the eye. So the blood supply of the eye come from the first branch of the internal carotid artery as it passes intracranially. This branch is called the ophthalmic artery. The ophthalmic artery arises from the medial aspect of the internal carotid artery, just immediately after it leaves the cavernous sinus. So what are the branches of the ophthalmic artery? This is very important to understand, and because it has important relations here, so please focus with me. So here is the medial, and here is the lateral. We have this is the ophthalmic artery at the origin, and we have relations of the ophthalmic artery at the optic canal. Then we have relations in the orbit, and finally we have the relations of termination. So here is the internal carotid artery. It will give the ophthalmic artery. Then the ophthalmic artery will just at the origin will be below the optic nerve and lateral to the anterior clinoid process. So at the start, the ophthalmic artery was below the optic nerve. So it will pass below, as you can see here. Then at the optic canal, it will, as you can see, it is trying to move lateral. So it is below and lateral inside the optic canal. Again, it is below and lateral, and enclosed within the optic nerve sheath. Then it enters inside the orbit. You remember that we said that the ophthalmic artery is one of the contents of the optic canal, together with the optic nerve and sympathetic fibers. So it is it runs in relation to the optic nerve enclosed within the optic nerve sheath until it leaves the optic canal and enter the orbit. Then it will pierce the meningeal sheath of the optic nerve, run forward within a short run forward for a short distance within the muscle cone, lateral to the optic nerve, and medial to the lateral rectus and abducent nerve and ciliary ganglion. So here will be the lateral rectus, together with the nerve supply to lateral rectus, which is the abducent, and also here will be the oculomotor nerve and ciliary ganglion. All these structures are situated between the optic nerve and lateral rectus or lateral orbital wall. Then the artery will turn medially to cross above the optic nerve. This is the usual thing, that the artery will cross above the optic nerve. This is in the majority of population. However, in 15% of population, the artery cross below the optic nerve. So why does the artery do this? This is because the artery will need to give its terminal branches, and its terminal branches are located medially. So it needs to move medially above the optic nerve. Then it will, after moving medially, it will run forward in close relation to the nasociliary nerve between the medial rectus and the superior oblique, and we have said this in the orbit. So we said that the nasociliary nerve has its close relation to the ophthalmic artery, and usually they pass together, so they are located between the medial rectus below and the superior oblique above. Then it will reach its final destination, so it will reach its final terminal branches. These terminal branches are present at the medial side of the upper eyelid. So at the medial side of the upper eyelid, it will divide into the dorsal nasal artery and the supratrochlear artery. So the dorsal nasal artery and the supratrochlear are connected to the ophthalmic artery at the eyelid. So let's revise it again. So the ophthalmic artery arise from the medial aspect of the internal carotid artery just after it emerges from the cavernous sinus, and it first will be below the optic nerve. So at the origin, it will be below the optic nerve. Then in the optic canal, it will be below and start to be lateral with the optic nerve. And after it emerges from the optic canal, it will be in the orbit, it will turn medially and cross above the optic nerve. Then at its origin, it will be the supratrochlear artery and the dorsal nasal artery. So this will terminal branches will be located medially, and they will represent the terminal branches of the ophthalmic artery. So after we know now the relations or the course of the ophthalmic artery, we need to know the branches of the ophthalmic artery. So we have 10 branches of ophthalmic artery. All the 10 branches are very, very important. The first one is the central retinal artery. So the first branch of the ophthalmic artery, as you can see here, the first branch, after it's emerged from the internal carotid artery, it will give this branch, which enter the optic nerve, which is called the central retinal artery. So the central retinal artery is the first branch of the ophthalmic artery that pierces the optic nerve sheath to run inside the optic nerve. So it runs forward for a wavy course below the optic nerve, outside but adherent to the dura. This is the dural covering. So it's outside and adherent to the dura until it will pierce the optic nerve. And when does it pierce the optic nerve? This is occur, or where does it occur? It occurs 12 millimeter posterior to the globe at the inframedial part of the optic nerve. So as we said, it was below the central retinal artery pierces the optic nerve medial and below 12 millimeter posterior to the globe. So what happens after this artery pierces the optic nerve? It will run through this 12 millimeters course within the optic nerve until it reaches the lamina cribrosa. Once it reaches the lamina cribrosa, the artery will decrease in thickness, so it will transform into arterioles. So the internal elastic lamina is lost, and the medial coat is incomplete until so that the terminal branches within the retina, it will divide into the superior and the inferior nasal and temporal branches, which will supply the retina. As you can see here, this is the ophthalmic artery giving the first branch, which is the central retinal artery, entering the optic nerve from inframedial aspect and run within the optic nerve until it reaches the lamina cribrosa. Then it will divide into the superior and the inferior temporal and the nasal branches that will supply the retina. So the blood supply of the central retinal vessels will share in the blood supply of the inner retina. However, the outer retina will be supplied by other parts, which are branches from what's called circle of Zen or circle of Haller, Zen and Haller. And we will discuss this now. So this is the ophthalmic artery. This is the central retinal artery perforating the dural sheath and entering into within the central retinal within the optic nerve. It will give small pile branches. Here can give small pile branches to the pyometer, and it will give the central collateral artery as it pierces the optic nerve, it will give the central collateral artery that it passes with the central retinal artery to the lamina cribrosa, and they give some fibers to supply the optic nerve or the macular fibers. And of course, it will give the terminal branches. So these are the main branches of the central retinal artery. Relations that is asked in the exam to be put in your mind. The ophthalmic artery run infralateral to the optic nerve in the optic canal. And the central retinal artery runs inframedial to the optic nerve in the optic canal. Again, ophthalmic artery runs infralateral to the optic nerve in the optic canal. However, the central retinal artery pierces the optic nerve inframedial to the optic canal, or inframedial to the optic nerve inside the optic canal. Okay, so this was the first branch of the ophthalmic artery. The second branch will be the ciliary arteries. So by ciliary arteries, we mean we have two ciliary arteries. These ciliary arteries arise as two trunks as it emerges from the ophthalmic artery while it is below the optic nerve in the form of long posterior ciliary artery and short posterior ciliary artery. So the short posterior ciliary arteries, as you can see here, arise as two trunks, here as a trunk and here as a trunk, as the ophthalmic artery is below the optic nerve, and these branches are divided into 10 to 20 small short posterior ciliary arteries that will perforate the sclera around the circumference of the optic nerve. So this has been discussed when we said the slide of the section of the back of sclera. We said that the short posterior ciliary arteries are one of structures that perforate the back of sclera. Then we have some of these short posterior ciliary arteries will anastomose around the optic disc to form what's called circle of Zenhaler. This circle of Zenhaler is responsible for supplying the optic nerve as well. So obstruction of this one of these arteries, which are the short posterior ciliary arteries that supply the optic nerve, will lead to what's called ischemic optic neuropathy. So the non-arteritic ischemic optic neuropathy are due to obstruction of the short posterior ciliary arteries supplying the optic nerve. So what are the branches? Branches of the ciliary arteries are, some branches will be backward to supply the pyometer, while there are some other branches forward to the choroid as far as the equator. Here are the short posterior arteries supply the posterior choroid. And there are some arteries that are directed inward, which toward the optic disc, as I told you earlier, and supply the area of retina around the optic disc. This sometimes one of these branches of the circle of Zen can be large to supply the macula, which is called the cilio-retinal artery. So you remember from the next slide, I will tell you. Here is the short ciliary arteries. Branches of the short ciliary arteries will form what is called incomplete circle of Zen around the optic disc, and will supply or give branches that will pass backward in the choroid to supply here, will supply back of the choroid as far as equator, and forward this forward and inward or backward to the pial network, here supply the pyometer, and they are giving inward to share in the formation of incomplete circle of Zen, and they may lead to formation of the cilio-retinal artery, which is present in 20% of population. So as I told you, this is the healthy retina, and this is the central retinal artery occlusion, causing a complete loss of vision due to obstruction of the inner layers, or loss of supply of blood supply to the inner layers of the retina. However, if this patient is lucky, he may have a temporal cilio-retinal artery, which is a branch from the ciliary circulation that will supply the macula and the optic disc. So this patient will have preserved central vision. This is the short ciliary arteries, and this is the circle of Zen. Other arteries are the long ciliary arteries. So the long posterior ciliary arteries are branches of the ophthalmic artery that runs at both sides of the optic nerve. So they perforate the sclera at 3 o'clock and 9 o'clock at both sides, medial and lateral, from the optic nerve, and they pass into the suprachoroidal space until they reach the anastomose with the anterior ciliary arteries to form the radius major in the ciliary body. So the circulus iridis major, again and again, it is formed by anastomosis of the 7 anterior ciliary arteries and the 2 long posterior ciliary arteries. This circle, or this network of arteries, it is present in the ciliary body, not in the iris, and they send anterior branches to supply the iris, and they send the posterior branches to supply the choroid as far as equator. So this area wasn't supplied by the posterior ciliary arteries or short posterior ciliary arteries. So here comes the rule of circulus iridis major to supply the area of choroid until the equator. The third branch of the ophthalmic arteries is the muscular branches. And from its name, the muscular branches are branches to supply the muscles. So they arise from the ophthalmic artery, medial to the optic nerve and lateral to the optic nerve, and sometimes they can arise from the lacrimal artery and the supraorbital artery. So the medial muscular branch will supply the inferior rectus, inferior oblique, and the medial rectus. Here we can see these are the muscular branches. And the lateral muscular branch will supply the lateral rectus, superior oblique, and levator palpebrae superiosus. This is just a repetition of what we have just mentioned in the previous lecture. So the anterior ciliary arteries are the terminal branches of the 2 muscular arteries of each rectus, except the lateral rectus, which has only 1 muscular artery. So these anterior ciliary arteries here, again, this is the anterior ciliary artery, which is the terminal branch of the muscular artery for the rectus. The anterior ciliary artery will then bifurcate into 2 vessels, one perforating the sclera and the other non-perforating that extend toward the cornea. So here is the non-perforating that extend toward the cornea, that will continue later on as anterior conjunctival artery to meet the posterior conjunctival artery at the cornea near the limbus. And there is a posterior branch that will perforate the sclera. The penetrating branch that will perforate the sclera will provide blood supply or share in the formation of the ciliary body, that share in formation of the circulus iridis major present into the ciliary body. It will send the branches to supply or to share in the formation of the choriocapillaris, while the non-penetrating artery, it will continue extend forward as anterior conjunctival artery that will meet the posterior conjunctival artery 4 millimeter away from the limbus to form the pericorneal plexus. So this will leading to the network of blood vessels that will be injected in case of ciliary injection. The fourth branch of the ophthalmic artery is the lacrimal artery. So from its name, it is apparently it will arise lateral to the optic nerve, or lateral, it arises from the ophthalmic artery as it passes lateral to the optic nerve, because it needs to go to the lacrimal gland. So it will supply the lacrimal gland, it will pass over the superior border of the lateral rectus until it reaches the lacrimal gland. The branches of the lacrimal artery, it can give zygomatic branches and the lateral palpebral artery. So remember that the lateral palpebral arteries are the ones that will perforate the orbital septum and share in the formation of the marginal arcades, together with the superior medial palpebral artery and the inferior medial palpebral artery, which are branches from the medial palpebral artery. So the lateral palpebral arteries are branches from the lacrimal nerve or lacrimal artery. The medial palpebral artery So as it is medial, so it will arise as the of the from me as the ophthalmic artery is medial to the optic nerve, or sometime it arises from the terminal branch of the ophthalmic artery, which is the dorsal nasal artery. So here is the medial palpebral artery, and we have again two medial palpebral arteries that will divide that divide into superior branch of the palpebral artery and the superior and inferior branch of lateral palpebral artery to make the marginal arcade in the upper and lower lid, and to make the peripheral arterial arcade into the upper lid. The sixth branch of the ophthalmic artery will be the recurrent meningeal artery. So why it's called recurrent? Because it return back. It return back from the ophthalmic artery toward the cranial cavity. So as we said in the orbit, it will return through the superior orbital fissure to the cranial cavity and anastomose with the and it anastomose with the middle meningeal branch of the maxillary artery, which is the terminal branch of external carotid artery. So here we can see that the recurrent meningeal artery passes through the superior orbital fissure and it will meet the middle meningeal artery. That's why it's called recurrent. The seventh branches are the ethmoidal arteries. So as the ethmoidal artery or the ophthalmic artery course medially to the optic nerve, it gives the anterior and the posterior ethmoidal artery. And this is also logic because it needs to supply the ethmoidal air sinus. So it needs to emerge from the optic nerve as it passes medially. So here we have the anterior ethmoidal artery supplies the anterior and the middle ethmoidal sinus, as you can see here, and supply the nose and skin of the nose, while the posterior ethmoidal artery will supply the mucosa of the posterior ethmoidal sinus and nose. Then it gives also the supraorbital artery, which arises from the ophthalmic artery superior as it passes superior to the optic nerve to supply the frontal sinuses. So the supraorbital artery, it passes forward to emerge from the supraorbital foramen or notch and anastomose with the superior temporal or superficial temporal artery and the supratrochlear artery. So it will anastomose with the frontal branch of the superficial temporal artery and with the supratrochlear artery. Finally, we have the terminal branches. So the terminal branches of the ophthalmic artery will be the dorsal nasal artery. Here it is the dorsal nasal artery, which is one of the structures that pierces the orbital septum, as we said, above the medial palpebral ligament to supply the nose and the lacrimal sac, as we said, and it anastomoses with the angular artery, which is the terminal branch of the facial artery. The second terminal branch will be the supratrochlear artery. The supratrochlear artery, again, one of the vessels that perforate the orbital septum, and it will supply the medial part of the forehead and scalp. So is everything clear up till now for the ophthalmic artery? Okay, we'll just take about 5 minutes break. Okay, 5 minutes, and we will continue after these 5 minutes. Okay, I'm back. Sorry for the interruption. Okay, so we discussed the branches of the internal carotid artery, which is the ophthalmic artery that concerns us. So we have also the external carotid artery can share in the blood supply of the eyelids and the eye. So what are the branches of the external carotid artery that are of particular importance to us? So we have the branches of the external carotid artery, which are the facial artery, the superficial temporal artery, and the maxillary artery. So here is the facial artery. The facial artery will give its terminal branches, which is the angular artery. The angular artery will anastomose at the medial canthus with the dorsal nasal artery. So the dorsal nasal artery, which is the terminal branches of the ophthalmic artery, will anastomose with the angular artery, which is the terminal branch of the facial artery at the medial aspect of the nose. So these blood vessels will share in the formation of the inferior arterial arcades of the eyelids, as we said. Then the external carotid artery will divide into two terminal branches. The superficial temporal artery, which is the first one and the smallest one, can be felt in the temple. Okay. It can be felt at the temple here, as you can see. Then it will give the transverse facial artery. The superficial temporal artery will give the transfacial branch, which will anastomose with the infraorbital artery to form the angular artery. And then it will also give the zygomatico-temporal or zygomatico-orbital artery, which will supply anastomose with the lacrimal artery and participate in the formation of the lateral palpebral arcades in the peripheral arterial arcades and the marginal arcades of the lids. Then we have the frontal artery. The frontal artery, it is the terminal branch of the superficial temporal artery that anastomose with the supraorbital artery. Then the second branch, or the second large branch, or the largest branch of external carotid artery will be the maxillary artery. So, we said before in the maxillary artery that it will originate in the pterygopalatine ganglion, then it will pass into the inferior orbital fissure. We said that it is one of the content of the inferior orbital fissure. Run into the orbit, then it will run into the infraorbital sulcus and the canal to emerge from the cheek, from the infraorbital foramen to be infraorbital artery. Then this infraorbital artery will anastomose with several arteries like angular artery of the facial, transverse facial artery, lacrimal artery, and dorsal nasal artery. Also, the branches of maxillary artery are the middle meningeal artery. We have just mentioned it when we said that the recurrent meningeal branch from the ophthalmic will anastomose with it. So this is the artery will be it will anastomose with the recurrent meningeal artery of the ophthalmic. And sometimes the recurrent meningeal artery itself become large and replace the ophthalmic artery or middle meningeal artery. So this was the vascular supply or the arterial supply of the eye. Let's now discuss the venous supply to the eye. Venous supply of the eye come from the four vortex veins. Four vortex veins, as you can see here. Then these four vortex veins will drain the blood into the superior and the inferior ophthalmic vein that will drain into the cavernous sinus. Please note that these blood vessels are valveless, so these veins don't have any valves. The connections of these veins are very important. So the superior ophthalmic vein is communicating with the angular vein, and the angular vein is communicating with the facial vein, while the inferior ophthalmic vein communicates through the inferior orbital fissure here to the pterygoid venous plexus. And we said that there are some emissary veins through that will communicate the inferior ophthalmic vein to the pterygoid venous plexus. We have said that when we were discussing the orbit and the contents of the inferior orbital fissure. So We have the superior vortex veins. They drain to the superior ophthalmic vein to the cavernous sinus. We have the inferior vortex vein drain into the inferior ophthalmic vein and the cavernous sinus. The central retinal vein, which will pass in conjunction with the central retinal artery and leave the eye 12 millimeter behind the globe, it will pass to drain either in the superior or in the inferior ophthalmic vein to the cavernous sinus. So let's now discuss, have more information about the vortex veins, superior and inferior ophthalmic vein, and the cavernous sinus, and that's how we will finish our lecture. So the vortex veins are 4 vortex veins. They are drain the whole blood supply from the eye, and they are attached. Their attachment to the sclera will limit the posterior extension of the choroidal detachment. They undergo ampullary dilatation before entering the sclera and give posterior tributaries and anterior tributaries. The posterior tributaries will drain the posterior choroid and optic nerve, while the anterior tributaries will drain the anterior choroid, ciliary body, and the iris. Superior ophthalmic vein. So how does it form? It is present at the root of the nose, or it starts at the root of the nose by junction between the angular vein immediately after it is joined by the supraorbital vein. So here we have the supraorbital vein, and here is the angular vein. As they are formed together, the superior ophthalmic at the root of the nose, they are forming the superior ophthalmic vein. So the superior ophthalmic vein will run in the orbit above the medial palpebral ligament and accompany the ophthalmic artery into the superior orbital fissure. Remember that we said that the superior ophthalmic vein is one of the contents of the superior orbital fissure that lies above the common tendinous ring. So it doesn't pass through the common tendinous ring, and it leaves the orbit through the superior orbital fissure to join the cavernous sinus. What are the tributaries of the superior ophthalmic vein? The inferior ophthalmic vein sometimes join the superior ophthalmic vein instead of driving the blood directly to the cavernous sinus. It gives anterior and posterior ethmoidal veins, so these will drain the ethmoidal sinuses. Lacrimal nerve, lacrimal veins, muscular veins, central retinal vein usually, anterior ciliary vein that will drain the ciliary muscle, and finally the 2 superior vortex veins. So all these tributaries pour the blood into the superior ophthalmic vein that will drain the blood into the cavernous sinus. The inferior ophthalmic vein, it starts near the floor of the orbit and run in along the inferior rectus to drain either into the superior ophthalmic vein or directly into the cavernous sinus. It receives tributaries from the 2 inferior vortex veins and from the conjunctiva and lacrimal sac and lower and lateral ocular muscles. Finally, the final destination for the venous drainage of the eye will be the cavernous sinus. So what is the cavernous sinus? From its name, it is a sinus that has many septa or cavernous. So it is an irregular shaped endothelial lined venous sac that's traversed by many septa that will give the cavernous appearance. So here is an anteroposterior view or axial view of the skull showing the cavernous sinus on the left side and the cavernous sinus on the right side. And this is a coronal view showing the contents of the cavernous sinus. So where is the cavernous sinus is located? It is enclosed between the meningeal and the periosteal layer of the dura mater. So it is enclosed within the dura on both sides of the sphenoid bone. So here is the body of the sphenoid, and here is the cavernous sinus, and the other one is here, extending from the medial end of the superior orbital fissure to the apex of the petrous bone. So extend from the medial end of the superior orbital fissure to the apex of petrous bone here. This is the dimensions of the cavernous sinus. Length it's about 3 cm, width it's about 0.5 cm, and the height is about 1 cm. So what are the relations of cavernous sinus? Anterior to the cavernous sinus will be the superior orbital fissure. So the superior ophthalmic vein, immediately as it passes through the superior orbital fissure, it will drain the blood into the cavernous sinus. And note that it is the medial end. Posteriorly, there will be the cerebral peduncle and the apex of the petrous bone and the trigeminal ganglion. Here is the trigeminal ganglion will be located posterior to the cavernous sinus. Superiorly, above the cavernous sinus will be the internal carotid artery, the optic nerve, and the optic chiasma. So the chiasma is located above the cavernous sinus, and the internal carotid artery will be, you can see it is present superior and also present inside, and we will discuss this now. How come? Because it will be coiled upon itself. So on cut section, it will be this is just before it enters the cavernous sinus, and this is after entering the cavernous sinus. Inferior to the cavernous sinus, there will be the body of sphenoid and the sphenoidal air cells, and immediately it will be the pituitary gland and the sphenoid air sinus and the body of sphenoid. Laterally will be the temporal lobe. So what is the relation of the internal carotid artery? Actually speaking, the internal carotid artery does not enter inside the cavernous sinus, but it is invaginating the internal carotid, the cavernous sinus. So this is because, so you can see two sections, because one of the section of the artery and the other is invagination of the cavernous sinus by the internal carotid artery. This invagination is present within the cavernous sinus, and there is a nerve related to the internal carotid artery as it passes through the cavernous sinus, which is the abducent. The abducent is located infralateral to the internal carotid artery. This is important and asked in the exam. So the abducent is located infralateral to the internal carotid artery. Here you can see this is what we meant by invagination. So the internal carotid artery, after it pass from the after it emerge from the petrous canal, it will enter the cavernous sinus from its back and emerge from the roof. So this is when the internal carotid artery enter the back, it will invaginate the cavernous sinus, and this is when it emerges from the roof. And the infralateral to the internal carotid artery will be the abducent nerve. So here what we discussed, it will enter from the back of the cavernous sinus, then it will emerge from the roof. That's why you see that there are two cuts of the cavernous of the internal carotid artery. And as it passes from the roof, it will pass between the second and the third cranial nerves, or the oculomotor. As you can see here, it emerges between the optic nerve and the oculomotor nerve. The relations of different cranial nerves to the cavernous sinus are of extreme importance. So this should be one of the most memorized facts in your study of the ocular anatomy. So the ocular cranial nerves and the other cranial nerves pass through the lateral wall of the cavernous sinus. This can be grouped into the following cranial nerves. The first one will be the third cranial nerve, then the fourth, then the first division of trigeminal, then the second division of trigeminal, while the abducent nerve runs infralateral to the internal carotid artery and not in the wall. So these are the nerves that pass through the lateral wall of the cavernous sinus. So what about the course? So here is the third cranial nerve. It will pass into the lateral wall of the cavernous sinus. Then it will descend to emerge from the cavernous sinus to enter the superior orbital fissure to be a superior division and inferior division. The fourth cranial nerve enter the cavernous sinus below the oculomotor nerve. However, it cross the oculomotor and try to rise up to emerge from the cavernous sinus above the third nerve. That is because it wanted to supply the superior oblique muscle, so it will go high. So it will enter the superior orbital fissure to supply the superior oblique muscle, which is present at the roof. Then the first division of the trigeminal nerve will pass in below the fourth cranial nerve. It will pass into the cavernous sinus and it will emerge as ophthalmic nerve that will enter the superior orbital fissure. And the second division of the trigeminal nerve, which is the maxillary nerve, as you can see, this is the abducent nerve. The abducent nerve will enter the superior orbital fissure to supply the lateral rectus. And finally, the first division and the second division of the cavernous of the trigeminal nerve will pass below the third and the fourth, enter the cavernous sinus, and then it leave it. However, the mandibular nerve, which is the division of the trigeminal nerve, does not enter the cavernous sinus. So what are the tributaries? What are the tributaries that will drain the blood into the cavernous sinus? So as we said, it will receive veins from the ophthalmic vein and the central retinal vein. And it also here, the superior ophthalmic vein will drain into the cavernous sinus. Then the superficial middle cerebral vein and the inferior middle cerebral vein will drain also in the cavernous sinus. So the superficial middle cerebral vein and the superior and the sphenoparietal sinus. So here is the sphenoparietal sinus and the superficial and middle cerebral vein and the inferior middle cerebral veins. And there are some small cerebral veins and hypoglossal veins also drain into the cavernous sinus. So where shall the cavernous sinus drain the blood? So the cavernous sinus will drain into the superior petrosal sinus. The cavernous sinus here will drain into the superior petrosal sinus that will pass through to the transverse sinus, and the inferior petrosal sinus, which will drain into the inferior jugular vein or internal jugular vein. The communications of cavernous sinus, it has an important communication with the cavernous sinus on the other side. So there is intercavernous communication above and below the pituitary gland. And this communication can lead to spread of infection from one cavernous sinus to the other in case of cavernous sinus thrombosis. Also, through emissory veins, it will communicate with the pterygoid venous plexus through the pterygoid canal. The emissory veins to the pterygoid plexus of veins through the foramen ovale and the foramen lacerum, and it can communicate also with the pharyngeal plexus of vein through the carotid canal. Here is the communication between the cavernous sinus and the pterygoid plexus. It can communicate either through the emissory veins or through the fiscal vein. So communicate with the fiscal vein through the deep fiscal vein, or communicate with the cavernous sinus through the emissory veins, and communicate with the inferior ophthalmic vein through the inferior orbital fissure. So what is the importance of this venous distribution or the communications between the different veins? This is because of the cavernous sinus thrombosis. The cavernous sinus thrombosis is a lethal disease. It can kill the patient, and it can come because of these communications of veins together. So if there is a face infection or the infection in the butterfly area of the face, this area is drained by the anterior facial vein. The anterior facial vein then will anastomose with the angular vein here and superior ophthalmic vein at the medial canthus. The anterior facial vein also drain into the deep facial vein to the pterygoid venous plexus to the cavernous sinus. So the infection can spread directly or indirectly from the facial infection through this venous distribution, either by angular vein and superior ophthalmic vein, to the cavernous sinus, or from the anterior facial vein to the deep facial vein to the pterygoid plexus to the cavernous sinus through emissory veins or through the inferior ophthalmic vein. Also, spread of labyrinthine infection can occur from a labyrinthine vein. So the labyrinthine vein will drain into the inferior petrosal vein to the cavernous sinus here. So if a patient has labyrinthine infection, this can lead to cavernous sinus thrombosis. Also, if the patient has a mastoid abscess or inflammation behind the ear, can lead to retrograde venous thrombosis. How this occur? This is by spread of infection to the superior petrosal sinus, from the superior petrosal sinus to the transverse sinus to the mastoid emissory veins, causing swelling behind the ear. And as we said, the cavernous sinus thrombosis, it is usually bilateral due to intercavernous communication. So what are the manifestations of cavernous sinus thrombosis? The patient will report ocular pain and photophobia and lacrimation due to severe congestion of as there is a lack of drainage of the venous blood from the eye to the cavernous sinus. Also, the patient will have features that suggest venous stasis. So there will be a congestion of the orbit leading to proptosis. There will be congestion of the conjunctiva leading to chemosis, congestion of the lid leading to lid edema, congestion of the optic disc causing papilledema, and the congestion of venous of the veins leading to retinal hemorrhage. Also, there will be congestion of the blood supply of the extraocular muscle leading to ophthalmoplegia, with the restriction of movement and of movement of the eye, or due to direct involvement of cavernous sinus thrombosis to the oculomotor nerve, the trochlear, and the abducent as they pass through the cavernous sinus. Also, it can lead to corneal anesthesia as the ophthalmic nerve or the first division of the trigeminal nerve is passed through the cavernous sinus. And sometimes, if we have bilateral cases, if we need to suspect the contralateral extension, this will be due to affection of the abducent nerve. This is because we said that there is intercavernous communication between both cavernous sinus. So since the abducent nerve run infralateral to the internal carotid artery, this will be the first one to be affected from the intercavernous communication. Okay, so this is the end of our today's lecture. I hope that you enjoyed it, and I know that it was lengthy and exhausting, but I hope that you these topics become more easy for you now, and when you study them with yourself, you will find them easier than before. Yes, I know. So here is finished my part, and here is your part to study this heavy information. Thank you very much, and see you next week with the final lectures of anatomy, ocular anatomy. And I hope that you will study well, because we will have a quiz after the anatomy. So try to study from now so that you will be prepared for the anatomy quiz that will be conducted after end of ocular anatomy.